Y'all, what's up? Welcome and welcome back to my channel. If you're new here, my name is Aysia. Please make sure you like, comment, and subscribe. Also, don't forget to hit that post notification bell so you get notified every time I post a new video. So if you're interested in nursing, lifestyle, beauty, vlogging, that's what we do on this channel. So make sure you subscribe. And as you can tell by the title, this is going to be my 6-month update as a registered nurse in Med-Surg. So if you're interested, please keep watching. Okay, y'all, so I hit my 6-month mark in August, which was last month, but I was on vacation for my birthday, so the Houston vlog should be going up before this one. So if you didn't see that one, go watch that one, come back to this one, okay? We got to get the views up, okay? Anyway, y'all, so back to my 6-month update. But yeah, so I'm more confident in my ability as a nurse. Before, I remember I was telling you guys that I was so scared. So now when I come on shift, I get my report, I go in all of my patients' room, I check the whiteboard, I change it, I change the date if it's not changed, I change my name to the nurse. I check on my patient, I see if they need, anything from me. I make sure that they have their TV remote, they call bell, their bedside table by them, so they're not calling me asking me for those things before I leave. I also make sure that they, if they need to go to the bathroom before I leave the room, I ask them, do you need to use the restroom? So they're not calling for that. What else? Hey y'all, so I forgot to say this in the video, but please, 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 if y'all don't do anything else, please make sure that y'all get malpractice insurance to cover yourself, because anything can happen. I have NSO, and no, they're not sponsoring this video, but if you're interested, I'll leave the link down below in the description box. You've worked hard to get your license, right? Make sure you work hard to keep it too. I'm also a little bit more confident in my assessments. So when I first get a patient, I'm making sure that I'm like eyeballing them. So I do a quick 5-minute assessment. I do focus assessments. Like if they came for, let's see, if they came for, they stumped their toe or something, I'm not going to be going crazy, assessing their heart and everything, because they're fine. It's their toe that's the problem. So I just, quickly eyeball them, make sure they're good. Their breathing is good. And I told y'all before in my last video, I document that, their breathing status, their O2 sat in the beginning of the shift, because you want to make sure you document that in the beginning of the shift. So, if your patient deteriorates, you know how they was prior to you coming on or prior to you starting the shift. But yeah, I feel like my assessments are more like thorough and to the point now. Before I was like taking my time and everything, but now I know what I'm supposed to look for, what I'm supposed to do. I also make sure that my whiteboards are completed. Like I was telling y'all, I fill out the whiteboards because my supervisor, my manager, they're really big on the whiteboards. They want us to put the ambulation status of the patient, the diet, because if somebody else comes into the room, they don't have to come running to look for you. They can look on the board and see what the patient, how the patient ambulates and what their diet is, and they can give it to them. But it's more important to come and check with the nurse first. But just in case, she said to make sure those things are on the whiteboards. I'm also more confident when I'm talking to my patients. So I know that I'm not the best with IVs, but I still try, because if you don't try, you're not going to get good at something. So I try like twice. If I can, if I can't get it, I call in the reinforcements, aka my coworkers. But yeah, I call them because a lot of my coworkers are really good with IVs. So I call them so I can get an IV, because they have this new rule that, we have to change IVs every 72 hours. So yeah, sometimes I gotta make sure my IVs are new, patent, and if they're not, they gotta be changed. What else? So as far as checking a patient's skin, when I get a new patient, I make sure I go in the room, introduce myself. I'm telling them, hi, my name is Aysia. I'll be your nurse. We just have to change it to the gown. I have to assess your skin. And while I'm in there, I'm asking them all the necessary questions. So I'm asking them, have they had the COVID vaccination? I'm asking them, how do they take their medications? Do they have any allergies? Or is there any abuse at home? Because these are the things that you need to document when you're doing your A&I, your flow sheet about the patient. So you want to, if they're able to, if they're A&O times 4 and they're able to tell you these things while you're in there, you know, checking their skin and everything like that, you want to ask them these questions because that's important. You need to document that in the chart. I also ask them if they're a smoker. If they were, I ask them for how long. I ask them if they do any illicit drugs. I also ask them about alcohol. Do they drink alcohol? If so, how many drinks do they think they have, you know, on a regular basis? What else do I ask them? I also ask them a couple of personal questions as far as on the A&I sheet. I can't remember them all right now, but yeah, I try to ask them all the questions that I need to, you know, fill out their patient profile to get that done, because as soon as a new patient comes up from the ER, you have to fill out the patient profile, you have to do the plan of care, and you also have to do an A&I, which is an assessment flow sheet. And I'm also getting better with, like, because before, I remember, I don't know if I told you guys, but like if a patient had a really low blood pressure and they was on blood pressure medications, I would want to hold the medication, but I would just double check with the doctor, because sometimes I would be a little hesitant, because sometimes they be saying, well, you know, that's okay, you can give it to the patient, but I always was double checking. Now I'm a little bit more confident. So if I see a patient with a high blood pressure, I know for sure he's going to get those medications, because it's going to help bring that blood pressure down. But I like when they put in the EMR the parameters. So say if the patient's systolic blood pressure is below 100 or their heart rate is below 60, you want to hold the medication. I wish that a lot of doctors put those parameters in, so you don't even have to call them, because sometimes I'll think about that and I'm like, wait a minute, let me just call to make sure. So I'm still a little bit hesitant when it comes to things like that. If I see a drug that I've never given before, of course I still always look it up. And I look up the side effects. I ask the patient, had they ever had that drug before? I make sure to, you know, make sure that they're not allergic to it, because you don't want no adverse reactions, because that'll be a nightmare. So I make sure I do that. What else do I do that I can tell you guys? So what else do I do? I'm sorry, y'all. I'm having like a brain fart because I'm trying to brain dump. I didn't want to write anything down for this video. I just wanted to be strictly organic of what I feel like I'm doing better in my update. Of course, y'all know. Yeah, of course y'all know, because I keep saying it all the time. I'm not sure if you're new here, you probably don't know, but of course y'all know my ultimate goal is to be a CRNA. If you don't know what a CRNA is, that's a certified registered nurse anesthetist. You have to get experience in the ICU before you can even go back to school for that. So my next transfer to another unit would be ICU. So I'm trying to get my experience in Med-Surg, because as soon as I'm done with Med-Surg, we're applying to the ICU, baby. I can't play no games. I got to get into school, because, you know, when you have the energy now to get the schooling and everything done, you have to do it, because then I'm just going to be stagnant. And I don't want that. I want to go back to school for what I want to do. So I'm going to try to get my experience in the ICU as soon as possible. And then I'm going to be applying for the CRNA program. So I'm super proud about that. Yeah, but as far as my update, I'm still learning. You're never gonna stop learning. So if you think you are, you're not. You're always gonna learn. And 30 years from now, if you're still in this profession, you're gonna be learning something new, because nursing is constantly changing. Like, I don't know how many times I have to stress that. So do not beat yourself up if you do not know something. If one of your peers knows something that you don't, oh well. At least you know now. You know what I'm saying? Like, I do not beat myself up for anything at all because I'm constantly learning. And I love that I'm constantly learning because this is a field where everything is constantly, is so innovative in nursing. So it's like, okay, I learned something new today. Great. Now I can take it with me. Now it's in my head now. You know what I'm saying? But yeah, y'all, so this is all I have for y'all for this video. Thank y'all so much for watching. If you have any other suggestions or if you have any comments, anything else you want to know, please make sure you leave it down below in the comments. Also, yeah, if you have any other suggestions or videos you want me to do, please make sure you leave it down below in the comments as well. And I will see you guys in my next video.